month, and all month long we'll be focusing on cardiovascular health and the innovations that are making care more precise, accessible, and patient-friendly. Today is part of our heart-to-heart interview series with Mercy heart specialist. Dr. Matthewkutty from Mercy's Plum Heart Center is here to talk about how these cutting-edge tools are improving outcomes and empowering patients to take charge of their heart health. Welcome. Thank you.
Thank you for having me.
Yeah, we had you on last year, of course, for our interview series.
Yes.
This time we're going to be talking kind of about technology and how technology is changing at just kind of an incredible pace, and it's also changing how we take care of our cardiovascular health and cardiovascular care. So how does that work?
So, over the last several years, we have seen technology just take off, and for cardiology, it's been absolutely amazing. From a patient standpoint, there are wearable monitors, people have watches, there are little devices that you can get that can get EKGs on them. From a technology standpoint, for our heart services, we've expanded quite a bit. It used to be for valves, we would only do open heart surgery. Now we have transcatheter aortic valve replacement where we can go in without opening people up. We have electronic medical records that sync in with all the other hospitals, so we have access to all that stuff. So when someone comes in, we know all the other tests that they have gone through. And then we have artificial intelligence within our fields itself where we can actually talk to our patients and not worry about writing down our notes because we have AI technology to type all those notes for us.
Okay. I want to talk about AI a little bit and smart technology because I think it kind of, I'm going to say freaks people out, but you know, people get nervous about AI, but it really can be a useful tool in the medical profession.
This is the case with anything new that comes out, right? Like when something comes out, there are aspects that are unknown, and I completely respect people that are anxious about it, but there are certain parts of technology that are very useful. So for us as doctors, when we use our scribe technology where we can just interact with our patients and not worry about documentation, which is tedious on us at the end of the day, AI is helpful. The other things where AI has been helpful for us is we're trying to implement it in our imaging to see if we can pick up things that might be subtle, that might be predictors of heart disease in the future.
Okay.
So there are good uses of AI. This is still new and there's a lot more coming, but so far we're trying to use all the good parts of AI to enhance the care that we're giving.
Yeah. Are your patients, do you notice are they embracing it, or are there still some
hesitation,
apprehension about it?
So I see both. I have some, I think mostly younger patients that are excited about it. So wearable technology people are all about getting their EKGs, getting their heart rates. It's also helping people get more into fitness because they can monitor these things. And then there are some that truly, are not sure, they're not comfortable being monitored. So I do see both ends of the spectrum.
Okay. I'm going to talk about, we both have our smartwatches on here. So you can use these to help catch heart conditions, correct? And they're accurate. This is an accurate.
It is accurate. So there are some people that have conditions called atrial fibrillation.
Okay.
And with that, that's an irregular heartbeat. What you can do is, if the heart gives you an alarm for irregular heartbeat, you can get there's an EKG feature on here that you can get to, and then you just leave your finger on it. Okay. And it can give you an EKG. And if your doctor has electronic medical record, then they can actually.
Let's see here. I'm sorry, I'm trying to get to it here. Heart rate, is that the one I want?
No, heart rate is also helpful, but there's actually, that one, ECG.
Oh, ECG, okay. Yeah. So now
you just hold it right there for 30 seconds and it'll give you an ECG, and you've got to be still. And if you're still, you can see a tracing, and at the end, most of the times it can tell you if it's normal or not. Okay. And if it says it's not normal, there is a way you can save it on your watch, and if your doctor has electronic medical record and you have MyChart, you can actually send it to the doctor by MyChart and they can take a look at it.
Okay. So like right now I could send this to my doctor via MyChart. Okay. Yeah. All right. That's interesting. I always wonder if these are accurate. So clearly they must be, because if you're utilizing them. Yeah, so as
long as your fingers are not too shaky, or you're not in a spot where there's a lot of movement, as long as you're still, yes, it's interpretable, and you can send it, and then the doctor can look at it. Okay. And I like it for my patients with AFib, because let's say if I have somebody who's traveling, and all of a sudden they get this surge of palpitations, they're not sure what's going on. They do that EKG, when they get off the plane, they can send that. They may come back to normal, but I can take a look and tell them, was this normal? Was it not abnormal? Right. So it can help for the future.
Okay. So there's a lot of great things with the smart technology and AI, and I know it makes some people nervous, but you can have a lot of advancement in people caring for their heart.
Right.
with
I mean,
and
for
heart
us,
health.
we're using it for all the right reasons. We're using it to enhance care, improve documentation, see what we can do to catch those things that may be missed, and hopefully, you know, detect more heart disease and help more people.
Okay, so people can really use technology to monitor their heart health.
That's right.
Okay. Thank you so much. I really appreciate you being here for our very first heart-to-heart interview.
Thank you for having me.
Thank you.